I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thank you for joining us for today's procedure. Today we visit with Dr. Lew Schon and his colleagues with the Institute for Foot and Ankle Reconstruction at Mercy as we tour the new Orthobiologic Laboratory. What are orthobiologics? Also known as regenerative orthopedics, this field involves products made from biological sources like blood, fat, and bone marrow, things that are naturally found in the human body. Their purpose? To help injuries heal faster and more efficiently. So, let's start the tour. Dr. Schon, thanks for joining us on Medoscopy today. What are we going to see today? We have this new Orthobiologic Laboratory. What is that exactly?
So the Orthobiologic Lab is a multi-purpose lab that is used for education, research, innovation, and inspiration. So the lab has many different capacities, obviously. We have areas where we could do cadaveric anatomy research and dissection. We could do new procedures. We could also have an area for basic science research, so we could look at tissue samples from people with end-stage arthritis and analyze it to see why those tissues have turned so bad, why the cells are angry and why they're eating up the cartilage. And we could do what we call cold culture studies, where we take stem cells and use them in conjunction with the bad arthritis and synovitis and see if that stops the degeneration of the cartilage. And as I mentioned, the last part is the inspiration. By doing all these things, we start to think of new ways to treat disease real-time in patients with real conditions, not just hypothetical lab diagnoses.
So you mentioned in terms of treating patients in real time. How does this translate, in your opinion, to how care is going to be affected for patients, how they're going to benefit?
Right. Because we're doing it real time here, we are learning instantaneously what we theorize is going to be effective in a patient. So we have an idea, we could test drive it here, and it may be the next step logically for the patient to have that, but we could actually test it beforehand and say, with this patient, with these tissues, this could be very effective. So we have a bit more certainty, and we're not relying on other people's data. We have other people's input. That's what gets us to the point where we say this may be effective for you, but then we could actually potentially test it before we do it with the patient being completely prepared, like, oh, this will be safe, this will be effective, this makes more sense because we've done testing here for it. So.
Now, the Foot and Ankle Institute has a fellow program, so you're seeing a lot of new doctors who are, trying to learn a little bit more about how to do foot and ankle and how to do it well, do it the Lew Schon way. How do you think the lab is attractive to them? I mean, that they're going to come here and study and have access to this type of technology and so forth.
Right. So we are attracting, we feel, the best candidates for our fellowship. We also have residents coming from University of Maryland who rotate with us as well. And we want them to be able to engage fully, not just in a clinical domain, not just in a surgical domain, but intellectually, as well as in the lab. They could do and see the basic science behind the things that they are seeing clinically and in the OR. And that fuller academic experience, again, attracts those students and residents and fellows who are top-notch, who are going to go on to train people in their facilities and change the way we look at medicine in the next generation. So they want to not just see the standard clinical and surgical stuff. They'd rather see the next level stuff in its formation, in its early stages, to take that as a point of inspiration for their future trainees and proteges.
You mentioned inspiration. How does the new lab, in terms of the work that you're being able to do now in the institute, how is it? What are you excited about? Let me put it that way. How do you feel that's going to enhance what you do for your patients?
Yes, for immediate example, we do stem cells when we are treating patients with ankle arthritis. And some people say, well, what's the justification for that? And here we could show basic science that will show that the synovium that's inflamed in ankle arthritis is treated best with the stem cells. We can mechanically replace the joint surfaces with metal and plastic, but the part that remains is the encasement of the ankle joint, and that can be affected by the stem cells, which is part of our treatment. So giving patients more information as to why we're doing what we're doing, and to give them a rationale and a perhaps better sense of the outcome with that.
Thank you very much, Doctor. Appreciate your time.
Thank you.
We're here for the opening of the new Orthobiologic Lab. What does that mean to you?
This is the culmination of a lot of people's efforts, especially Dr. Schon, our partner. He's a visionary and very creative, cutting-edge surgeon and researcher. And we think this is going to bring a lot of attention to Mercy and to our department and program in particular for our research efforts. We have a robust education program here with our fellowship. And this is just another piece of that puzzle, which I think is great to offer.
Yourself personally, how do you see utilizing the lab in your work, whether in research or with direct patient care?
I think it's going to be great in both domains. From a research standpoint, we have a very collaborative group. We all work together on projects and ideas, which helps all of us, accomplish things. And I think patient care, we have a beautiful lab space that gives us the opportunity to work on cadavers or practice new techniques, new implants or instruments and things to get ourselves better prepared for the operating room, for the real world, so to speak. So it really can act in both ways. So I think we're all excited about that.
Do you think having this lab makes Mercy a more attractive site for surgeons who are looking to do a fellowship in foot and ankle?
Oh, 100%. Yeah, it gives them opportunities for research, depending on their background, what they've studied previously or done research in. And also that educational part of things is a really good selling point for them.
Is there any aspect of the lab in particular that you're excited about?
I like the cadaver area that we can do new techniques and new surgeries and to help train, our fellows who are kind of the next generation of specialists in our field. So it's really exciting.
Do you think, just in your opinion, say we jump 5, 6, 7 years down the road, how the lab is going to impact treatment of your patients on a regular basis?
I think it will, because we'll be doing sort of cutting edge techniques and things that, if not developed here, certainly we can help to practice them or even perfect them for our patients. So it just helps all of us. It's another educational tool or resource at our disposal.
Thank you, Doctor. Appreciate your time. Dr. Patel, how do you think this new lab is going to affect your ability to work with patients? And you're, fairly new to Mercy. How do you think it's going to help you?
Well, I think a lot of questions that we have still don't have great answers. So a lot of things that we don't understand still come down to the basic science, and we need scientists to look at cells. So our operating room is just down the hallway, so we can take direct samples from patients who are willing to offer those resources, take them over to the lab, and look at them, collect enough samples, and hopefully figure out answers to maybe not help that direct patient, but patients in the future.
Is there any aspect of the lab that you're particularly excited about?
A lot of the cartilage things that we've been working on, we've been collecting samples of cartilage lesions. It's a really hard problem to fix in the ankle. Once you have arthritis, we can't really grow cartilage back. So if we can find some answers to help make that problem a little bit better, I think that would be go a long way.
Is that related to the work that in the past we've talked about, the total ankle replacement, where you're basically taking cadaver bone and replacing the person's diseased ankle. And there's been some, I know, issues with that, trying to keep the bugs off of them, as they used to say. You're hoping the lab might be able to help with that type of work?
Yeah, a little less severe arthritis. If we can take cartilage, harvest it, and put it back into the patient, hopefully we can avoid a total ankle replacement. But when we do get to the total ankle replacement point, the lab does help us look at the bugs, figure out, hey, are there ways during surgery to have less bugs, less infection? And we can always go back and forth between the lab and test samples to do that.
Do you have much opportunity to work with the fellows here?
Yeah, I work with them every day.
Do you think they're going to enjoy working in this lab? You think it's attractive to people who want to become fellows here?
Yeah, I think so. It's a pretty unique thing that we can offer compared to some of the other places around the country. It's very intimate. We work directly. Again, the proximity is a great factor. And I think once the projects are going, it's really easy to get the fellows involved, and they can get some papers, something productive out of it, even in their short time that they're here.
Anything else that you'd like to add, particularly from how you think this will benefit patients in the long run?
Yeah, I just think the longitudinal nature, especially of Dr. Schon's patients and samples, he's been collecting for years and years, so we have lots of time points. And again, there's a lot of problems we don't know the answers to yet. So I think across arthritis or fractures or tendons, hopefully we can get some more answers.
Excellent. Thank you so much. Dr. Main, what is the opening of this lab? How does it reflect Mercy's overall mission, in your opinion?
At Mercy, we're so grateful for the opportunity to care for people who need us. We're grateful to be there for patients who seek mercy. And this is just another foot forward, pun intended, in continuing that work in care delivery, in innovation, in solving problems of today that can be applied tomorrow for the patients we are privileged to serve. And we're just proud to play a role in it and proud to have great providers to bolster that. And we feel really blessed to be able to celebrate this today and celebrate the care of the people we're privileged to serve.
From your perspective, why is investing in innovation like this, the Orthobiologic Lab, so important for patients and the community?
Yeah, look, I think we have an obligation to not just identify what's in front of us, but when we identify problems that we just can't solve today, and we work hard to pool the resources together to help solve those problems, that's really, really hard work. You need to be patient, you need to be thoughtful, you need to be a visionary, and it doesn't happen in a silo. And Dr. Schon and the entire group have always been focused on delivering research that leads to outcomes at the end of the day. What have we learned? What can we change? And it's very iterative. And I think it's just part and parcel with who we are as an organization, trying to be the very best at what we do, the very best for the broader community. And I think that's happening here, and we're really proud of it.
Do you see this lab as influencing Mercy's reputation as a leader in specialty care?
I think we are very blessed. We draw from every zip code in the state of Maryland, and that happens because great providers, great staff, great care teams. Access is manageable. It's easier to navigate, and we work very hard to ensure that's the case. And so, I think we're there already, and this is just another step forward in that commitment to the people we serve.
So in terms of the training work that you're doing, now that you have this Orthobiologic Lab, how do you think you're benefiting from it?
I think it's an incredible opportunity to pursue research, like bench research. We do a lot of clinical research, which has to do with chart reviews and different studies in the operating room. But if we can also take what we're doing in the operating room and apply it with the basic science principle, it kind of expands a lot of our opportunities to impact patient care long term.
Is there any particular aspects of the lab that you're finding particularly intriguing or interesting in terms of your work?
I think their work with the cell biology, and Dr. Schon really likes BMAC and looking at stem cells. I think that's very interesting. And also the lab provides an anatomy dissection component, so we can go down there and train and become more proficient in our surgical skills outside of our regularly scheduled patient care. So it's a great opportunity for us.
What's it been like working with Dr. Schon and his colleagues?
Dr. Schon's fantastic. The whole department's fantastic. Mercy's been such a wonderful place to train, and they're all so caring, and just so proficient in their craft. It's been an honor to be here.
Have you seen, in terms of your work in the lab and what the lab has to offer, how it's translating into patient care at this point?
Yes, absolutely. I think everything Dr. Schon especially, is very good at integrating things that happen in the lab into his practice and then into the operating room, and then he passes that on to us. So it's like a nice multi-level integration.
Do you think having the lab makes this site more attractive to doctors who want to train and learn about foot and ankle surgery and the latest in that field?
Yes, definitely. I think it, like we've talked about a lot, it provides a lot of research opportunities, and I think that's the currency of kind of becoming very good in your field. And so people really want to be at places where there's a lot of research.
And you like Mercy?
Love it. I'm going to miss it a lot when we leave.
Well, thank you so much. Dr. Day, you're the research resident, I understand?
Yep, I'm the research resident.
And what does that entail?
So I help manage, coordinate, and execute research studies within the foot and ankle department. I work with Catherine and the rest of our staff, and we do everything from basic science research to clinical studies. And we do studies from retrospective review all the way to studies when we're enrolling patients actually in clinic. And so it's exciting. Other projects span from anything from total ankle replacements, as Dr. Schon's very passionate about, all the way to the basic science stuff that Dr. Lew Schon is doing. So yeah, we do everything.
So how does this new Orthobiologic Lab feed into the kind of work you're doing research-wise?
Yeah, I mean, I think the most important thing is that everything can be done in-house. There's a lot of institutions in the area that we've had to previously maybe outsource stuff or go to their labs and use their equipment. But the exciting thing now is that we can all do it in-house, and so the opportunities have really opened up.
In terms of the lab and the research that you're doing, what are you particularly excited about?
So I actually personally like clinical research more. So I do like seeing the patients when they come back in clinic. I like seeing how they're doing, 5-10 years out from their total ankle replacement. And so for me, it's seeing how patients are doing after their total ankles, especially patients who've had very complex reconstructions, because there's not really much written out there in the literature. And so if we are able to share kind of our results and how these patients are doing, hopefully that can improve the care that we give patients.
I was going to say that the lab helps you bridge that gap between when the patient has the problem to you're seeing the patient in clinic.
Yeah.
And so, it's all part of one overall program of how this all works from the day that the patient walks in and says, I have a problem, can you help me? All these pieces work together, the lab, clinic, everything else. Would you agree?
I absolutely, yeah.
Dr. Jeng, we're here for the opening of the Orthobiologic Lab. What does that mean for the Institute as you serving as the director?
This thing has been in the works for 7 years since Lew came here, and really, it's kind of interesting. It's every year. It seemed like for our birthday, Christmas, Hanukkah, we get a new piece of equipment, and it's taken this long to finally get the whole thing together. So I think it was time to bring everyone here to see a fully operational Death Star. But really, this thing is an amazing thing. It's going to be something where it's great, like Lew was saying, to be an orthopedic surgeon and take care of our patients and getting them back up walking on their feet again. But this is the next level thing. So this is trying to figure out how we can make cartilage last longer, how we can heal tendons stronger, how we can make bones heal quicker. That's what this is all about. And so I'm just looking forward to some amazing things coming. They already have, but even more things coming out of this institution in the next future.
I already know that the Institute here is a nationally recognized place, but how do you think additions like this, and of course the work of Dr. Schon and his fellows and all your colleagues, are helping to raise the profile to even, as you mentioned, an even higher level?
It really keeps putting us on the map further and further. One measure of it is the competition for fellows. And, every year we are competing with our colleague fellowship programs in the country for the top fellows. And every year we are able to fill our fellowship, whereas many other fellowships get no candidates, get no people filling their spots. And so it's just, it kind of documents that what we're doing here is the right thing, that people recognize that they respect it and they want to come get a taste of it and be part of it.
Anything you're particularly excited about in terms of the future of the Institute, given the work with the lab and just, it seems, as you mentioned, always something new coming out?
Yeah, I mean, I think we keep wanting to figure out how we don't have to do fusions and replacements, how we want to be able to preserve the native joint and not have to use metal as much anymore. So that's the future, I think, not using metal like we do for most of orthopedics, but actually kind of preserving what you already have and bringing it back to a healthy situation.
I'd like to thank Dr. Lew Schon and his colleagues with the Institute for Foot and Ankle Reconstruction at Mercy and members of the Mercy family for providing us this look at the new Orthobiologic Lab and for their insights into what it means for doctors and patients alike. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you.